I'm going to officially open this media briefing. Good morning, ladies and gentlemen. My name is Foster Mohale. I'm responsible for media relations in the National Department of Health. Without wasting any time, I'm going to declare this media briefing officially opened. And I'm going to start by introducing the lineup of the day. As usual, Honorable Minister, colleagues, we're going to get the opening remarks and message of the day from the Honorable Minister of Health, Dr. Joe Patla. He'll be followed by Dr. Michelle Groom from NICD, who's going to give us the observations as far as Omicron variant and the fourth wave is concerned. She will be followed by Dr. Matebula from the CEO of Steve Biko Academic Hospital, who's going to give us the clinical experience and observations as far as dealing with this variant is concerned. She'll also share with us her personal experience of dealing with this variant. She will be followed by Prof. Glenda Gray, who's the president of MRC, who will be accompanied by Prof. Alex Segal, who are going to give us the presentation as far as effectiveness of our vaccine are concerned. Then we'll be having the media interaction session, followed by closing remarks by the Honorable Deputy Minister, Dr. Sibongiseni Dhlomo. Without wasting any time, I'm going to hand over to the Honorable Minister, Dr. Joe Patla. Over to you, Minister.
Thank you very much. Thanks, Foster, always very capable in setting up and coordinating this press briefing. And greetings to Deputy Minister Dhlomo and to the DG, Dr. Crisp, and all the panelists, Prof. Glenda, and the rest of the team, NICD. Welcome to Dr. Matebula, CEO of Steve Biko. We're happy to see you. You'll also tell us as Foster has said, your personal experience with, I don't know whether just to say COVID or Omicron. Ladies and gentlemen, we are back to keep you updated on developments in as far as the COVID-19 pandemic in the country and how we're managing in containing this invisible enemy. Now, we know that a few weeks ago, exactly on the 25th of November, together with Professor Tulio de Oliveira and other of his colleagues, we made an announcement about the new variant, the B1.1.529 as it was then, which was subsequently at that time having been discovered in South Africa and Botswana and Hong Kong. But subsequently on the 26th of November, it was given the name of Omicron by the WHO. As of 2 days ago, 42 countries in all the 6 WHO regions had reported this variant. But yesterday, the Director General, Dr. Tedros, reported even more countries, that 57 countries had reported this variant. Now, Omicron has driven the resurgence of COVID-19 cases in South Africa, with currently just over 90,000 cases reported nationally from the 7th of November to 4th of December 2021. Weekly cases in Gauteng province have increased by more than 400% for the week of 4th December 2021 compared to the previous week. So a very significant increase just in that week, while hospital admissions increased by more than 200%. Now, the recent genomic sequencing by our network of genomic sequencing teams revealed that Omicron was the dominant variant amongst samples sequenced during November 2021. Up to 70% of those specimens showed Omicron. That is, as far as of yesterday, 70% of the tests done were showing Omicron as the dominant variant. Omicron is most likely the variant driving the increase in cases in Gauteng province over the last 3 weeks. This variant of concern as we've said, as the scientists reported, has multiple mutations that may have an impact on how it behaves. The scientists have been conducting rapid research to better understand many aspects of the Omicron variant, including how well this variant transmits and whether it can escape some of our immunity. And we'll share their findings on these studies as more and more results become available. But what is known currently in terms of transmissibility, well, it's not yet fully very clear, but it seems likely that it is more transmissible, just looking at the way in which it has spread over a very quick period with a very steep graph of the spread of the infections over the last 15 to 20 days. As if you compare that to how the previous variants, such as the one which which it is just replacing now, the Delta variant. So we can see a significant difference in the graph of how Delta spread and how Omicron is spreading. Omicron very quickly has displaced Delta, is quickly, quite seriously displacing the Delta variant. In Gauteng, almost displaced it. The number of people testing positive has risen in Gauteng, and this variant, the Omicron, has also spread by now to all the provinces. Now, what also shows that it is highly transmissible is that the reproductive number of the virus, which shows how many people are likely to be infected by one person, is currently 2.5, which is higher than it was at any prior point in the pandemic. So whether we speak about the Alpha, the Beta, the Delta, none of them had even reached anywhere close to 2 in terms of the reproductive rate. Now the Omicron has passed 2 and is now at 2.5. The severity, in terms of the severity of disease, this one is also not yet clear with the Omicron, whether it causes more severe disease or if it leads to even people admitted to ICU and death, as if you compare it with the previous variants, especially the most recent one, which is the Delta. So this information is not yet clear, but preliminary data does suggest that while there is increasing rates of hospitalization, which may be largely due to overall big numbers of infections, and Dr. Matebula will speak to this, and also our colleagues from Dr. Jassad from the NICD will also speak to this, but it looks more like that it is purely because of the numbers rather than as a result of any severity of the variant itself, of this Omicron. Early data from DATCOV, which is monitoring our hospital admission, the hospital surveillance, shows that among patients who already had a hospital outcome and were no longer in hospital, a lower proportion of patients admitted in the fourth wave, currently, this is the fourth wave, had severe disease as compared to patients admitted in a similar time frame in the second and third waves. So in this case, severity is defined as any patient who developed acute respiratory distress syndrome, patient who received oxygen, who had to be ventilated, or was treated in high care or succumbed to the virus. Similar experiences have been reported both from the public and private hospitals in Gauteng. It must be noted that severity data has several limitations at the earliest phase of a wave when the numbers are small. Patients with mild symptoms are more likely to be admitted as a precaution in the early days. Patients are diagnosed with COVID-19 incidentally when admitted for other reasons. I think we heard this also from the CEO of Netcare that was their experience. And because there has not been sufficient follow-up time for severity and outcomes to have accumulated, which is typically up to 3 weeks after diagnosis. So this is still early days, but there are very promising signs that largely patients, even those who are in hospital, are mild. Many of them are incidental. They came into hospital for other reasons, other illnesses. And because when you have to be admitted, you have to be tested first. And many of those who had come for other reasons have tested positive, notwithstanding that they are not ill from the COVID-19 variant itself. Understanding the level of severity of Omicron variant will take some weeks. Our hospital surveillance has demonstrated that patients still do experience the full spectrum of the disease, from mild to severe, at the extent of which, in terms of number of patients, this is still to be determined. All variants of COVID-19, including Delta variant, that is still currently dominant in most parts of the world, can cause severe disease or death, especially for the most vulnerable people, those who are older and also with underlying medical conditions. And thus, prevention, as we always emphasize, is the key, rather than waiting until you get infected. In terms of the symptoms, we have from reports from various doctors, we don't have any information that suggests that this variant causes different symptoms from other variants. Anecdotal information from doctors have reported that patients present with scratchy throat, cough, fever, diarrhea, and vomiting. In children, many have no respiratory symptoms. So children often test positive without any respiratory symptoms. In terms of whether prior infection protects you, preliminary evidence suggests that there may be an increased risk of reinfection with this variant. People who have had previous COVID could become infected more easily with this variant as compared to the previous variants of concern. A preprint, not yet peer-reviewed article has been published on the risk of reinfection in South Africa, reporting a 2 to 3 times increase of reinfection. Reinfection is defined as positive test after 90 days have passed from the previous infection. But more information is required and will become available in the next days and weeks in terms of the significance of these reports. In terms of the vaccines, I know many people have been concerned, and also in the world. Our scientists are also still conducting more studies to understand the potential impact of this variant in as far as how it behaves towards vaccination. And this will also take some time. But current vaccines have shown to be effective, even as this wave has been spreading, because the significant number of almost, in many reports we have received, suggests that 70% of those who have been admitted to hospital are those who are unvaccinated. So as things stand, the vaccines are showing to be really still very strong in protecting against severe disease, as it has been with the previous variants. It shows what the figures from the numbers from hospitals does show that indeed those who are vaccinated are much better protected even against this. So there are some indications that some of this, there might be some weaknesses in as far as some of the vaccines. Some of the reports indicated there might be some weaknesses on the Pfizer, but again, this is very early. But overall, what we are seeing is that the protection is still very strong, even on this variant, as I've said. At least those who have been admitted to hospital, it shows up to 70% being those who have not been vaccinated. The PCR tests are still very effective. Also in terms of the rapid antigen test, also shown to be very effective in picking up this variant as well. Current treatments are also still very relevant: steroids, corticosteroids, oxygen therapy, antivirals, anticoagulants, all this which have been used over the last 20 months or more have shown to be very effective. The issue of infection of children, let me just touch on that. During the 3-week period from 14 November to 4 December, there has been an increase in admission of children under 5 years. This has been observed in the Tshwane Metro hospitals, where the early resurgence has occurred. Children 18 years and younger comprised 21% of admissions during the early period. However, this pattern has changed over the subsequent time from the early days, and the proportion of admissions in children less than 5 years in total admissions has decreased to 14%. It was 21, then 14% in week 46, and currently it's even lower at 8%. So this seemed to have been the phenomenon early, but it has now changed to more adults getting infected. The provincial and national picture is indicating an increase in both cases and admissions amongst children of all age groups, but no change in the proportion of children getting seriously ill or dying. Early data from hospital surveillance also reports from public and private hospitals indicate that admissions are largely in children admitted for other reasons and then testing positive and for very short durations. So despite making up 30% of the population, the younger people comprise only 12% of cases and 5% of hospital admissions. However, the children who are at risk of severe disease are those under 1 year, and people with other comorbidities. For children who are premature and who have diabetes, cancer, and also those with HIV and TB. It is not yet clear what is driving the apparent increase in children, but I'm sure some of the panelists will also comment about this. But what we want to say is that there is really no need for alarm. We expect this variant to behave the same way as the previous variants. As we've said, other aspects of transmissibility is showing, but in terms of severity of illness, there are signs that actually they might be less severe, and other panelists will comment further in terms of this. We know that vaccines, as I've emphasized, it remains the bulwark of our protection against all these variants. Now, in terms of how we progressed in terms of this, as of yesterday, the 9th of December, we are just short of 27 million doses. I think by today, early today, probably already by now, we must have crossed the 27 million doses administered. We have passed the 43% of adults covered, although this varies from province to province. Provinces such as KwaZulu-Natal and Mpumalanga are still low at 37%, while Free State and the Western Cape province have already surpassed 51%. We're still doing better with the over 60s at 65% plus, and the over 50s having passed 60%. The 35 to 49 still just over 45, I think about 48% now. The major struggle which we're having is still with the younger people 18 to 35 years of age, which is still below 30%. So we really would like to urge everyone to work with us to motivate the younger people. The reason why our vaccination rate has dropped from the highs of 290,000 per week to just around 150, 160, 290 per day to about 150, 160, sometimes even 140 to 130 in a day is largely because while there's been good coverage of the over 60s and over 50s, the young adults are not coming up in good numbers. And we would want to urge them not to listen to what they read on social media, all the anti-vax stories. Protect yourselves by coming forward and taking the vaccine. Now, I want to again repeat that this is really the best protection for us going forward. So what we'll be doing in the next few weeks, the scientists will continue, as they've done in the past, to conduct quality research to understand this variant and share the information as quickly as possible. Our scientific advisors continue to provide our government the guidance on what kind of restrictions we need to, if we have to impose further restrictions, the expansion of vaccination, and also introduction of new treatments. Government will work hard with our provinces to make sure that our health facilities are ready for any eventuality, making sure that our search plans are ready. We will make decisions about what further restrictions based on this advice from our scientists. As I conclude, for start, I want to again just say that this is the time that while there might be a lot of concern, there should be no panic. Even this variant, as far as we can see over the 2 weeks or so, can be under control, working together. We can reduce transmission, even though it does look highly transmissible. We can work together to reduce those who fall seriously ill by making sure that more people are vaccinated. So it is important that we must continue to use all the non-pharmaceutical protective measures, which we all know, wearing masks which are well-fitting, good ventilation, avoid crowded places, which are poorly ventilated, washing hands, sanitizing, and all the other measures. So as we conclude and wish everybody a very good festive season, we can have a good festive season if more people vaccinate and if you all keep safe. Thank you very much.
Thank you, Honorable Minister. Indeed, it's our collective responsibility as individuals, families, employers, communities, the province and the country to have a great Christmas or festive season this year. Without wasting any time, I'm going to call upon Dr. Michelle Groom, who's going to lead us on the observations on Omicron variant and the fourth wave. Over to you, Doc.
Thanks. Good morning to everyone, Honourable Minister, Deputy Minister, DG, DDG, colleagues. So I think I'm just going to expound a little bit on details that the Minister has given just in terms of the epidemiology. So we're sitting at just over 3 million laboratory confirmed cases. As you could see, our 7-day moving average has been increasing from week to week, where we're sitting now as of 2 days ago, just over 13,000 7-day moving average, and a large number of cases which were reported yesterday, going up to just over 22,000. And so you can see just that rapid increase compared to some of the other waves, or to the previous waves. Most of this is driven by Gauteng at the moment, which was the first province to start seeing these increases. This is the absolute number of cases on the left and the incidence on the right, where we're accounting for population size. And you can see that we are starting to see increases in the other provinces as well. Just in terms of the age distribution, so very early on, remember, we saw that there seemed to be the younger age groups most affected, and we saw this towards the end of the third wave as well. And at the moment, the incidence is highest in the 20 to 39-year-olds and 40 to 59-year-olds, and then followed by those over the age of 60. Just in terms of our testing, so this is both the PCR and antigen testing, and you can see a dramatic increase in the number of tests that are being done. Compared to a few weeks ago, you can see the increase in the percent positivity, which is the number of positives out of the tests that were done. And you can see this dramatic increase, which is much higher and quicker than we saw with the third wave. And as of yesterday, we were just under 30% nationally in terms of positivity rates. This is just showing the positivity rates in South Africa, just the distribution. This was 2 weeks ago, where we just had some inklings of that start of the increased number of cases and positivity in Gauteng, how this spread onto the neighboring provinces. And you can see now how these high positivity rates, the red is over 30%, are now filtering into the rest of the country. This is just by province, showing that there are increases in positivity rates across all of the provinces, obviously leading by Gauteng, as that was the first province to really start showing these increasing numbers, followed by the Northwest, Mpumalanga and Limpopo. But we are starting to see these increases in other provinces as well. Just in terms of the waves, using the previous wave definition, you can see that South Africa had officially entered the third wave, as the Minister had mentioned last week. And we have several of the provinces that have also Gauteng, Mpumalanga, and Northwest that have also officially entered their 4th wave. Just looking at the reproductive numbers, so we published an updated report this week, which is available on our website. And so this really has increased to 2.5 nationally, with just over 3 in Gauteng. So definitely the reproductive number highest that we've seen at any point during the pandemic. Moving on to the hospitalization data. So this is from DATCOF, which is the hospital surveillance system of all public and private hospitals. And you can see this is just the increase in hospitalizations over the last weeks. There usually is a little bit of a drop off. So don't take this into account because this is just delays in terms of the reporting of the data, but we can see increases in hospitalizations in both the private and public sectors. At the moment, this is driven mostly by Gauteng. Once again, this is to be expected as this was the province that first started showing the increase in numbers and starting to see small increases in the other provinces, notably the ones that followed Gauteng, so Northwest, Mpumalanga and Limpopo. This is just showing the number of cases in orange compared to admissions. Okay, and so for each wave, you can see that the number of cases and hospitalizations go up during the wave. I think what's quite interesting this time is if you have a look in previous waves, we actually started seeing the increase in hospitalizations in the 2nd and 3rd wave, even before, you know, we had this dramatic increase in the case numbers, which is slightly different for this wave where we first saw the increase in cases and then started seeing these hospitalizations. So early indications that we may be starting to see a disconnect between the cases and hospitalizations. On the right is really just the number of admissions in grey and the proportion or percent that are being admitted. And so you can see there's a much lower percent that are being admitted. And this is possible that it is just because of the timing in that we've seen a rapid increase in the number of cases and the hospitalizations do take some additional time for these outcomes to occur, but early on showing that this reduced proportion being admitted. In terms of deaths, we're not really seeing any indicators at the moment, maybe a slight increase starting in terms of overall. We are seeing small increases in terms of the number of deaths in Gauteng. But once again, this is at a very low level. You can see that the number of deaths were lower even at the interwave periods between the 1st and 2nd and 3rd waves. And so the other provinces showing small increases. So this is just comparing the current 14 days to the previous 14 days in terms of the average number of admissions. And so you can see for Gauteng going from an average of 32 2 weeks ago to 181 admissions. So this is a big increase, starting to see increases in the other provinces except for Northern Cape. And starting to see some small increases in deaths in Gauteng. I just wanted to focus in a little bit on Gauteng, as this is the province, obviously, that started with the increase. And so we have a little bit more data on the Gauteng province. And so just looking at the age groups, so these are the last 3 weeks, with week 48 being the week ending on this past Saturday. And so in the different age groups, you can see that we did start 3 weeks ago with a larger proportion in that under 20-year age group. And this has decreased as the case numbers have increased. And we are starting to see slightly increased proportions in the older age groups. And so this is in keeping with what other data where, you know, we started in the younger age group, but we are moving out into those older age groups. This is the data just broken down by smaller age bands. I think there was a lot of concern initially with these high proportions of admissions in the under 5s, but there has been this decrease, as the minister alluded to, in the last 2 weeks, where it's coming down from 14% just to just over 7%. And so you can see we're starting to see these increase in admissions in our older age groups as well. So I think slightly different, you know, as this wave is unfolding in terms of those age distributions. Just to highlight that if we just plot the population vaccine coverage, that the admissions that we are seeing are tending to be in those age groups with lower vaccine coverage. And so we would be expecting, we've got good vaccine coverage, particularly in our over 60s, and that they would be largely prevented from severe disease, including hospitalizations. And I think we are working together with the National Department of Health on a dashboard where we'll be able to break this down in more detail. Just in terms of some early severity data, and once again, just as the Minister had said, a couple of biases at this early stage in that we're early on in the wave. Some of these may be, we record hospitalizations with any COVID positive tests, so many of these may be incidental positives. There are also, it's good bed availability, and mild patients might be admitted when they have milder symptoms compared to later in the wave. And also we've seen this rapid increase in cases, and it might take an additional week or two to see and accumulate all the outcomes. But early data from Gauteng, just looking at the features of severity, looking at the number that are needing oxygen to be ventilated and that are needing ICU, that there are early indications that we haven't seen dramatic increases in that. During this early part of the wave. We've also looked at the case fatality ratio, which is the number that are dying in hospital. And once again, no indication that this has been increasing. And also the median length of stay. So this is the number of days that patients are staying in the hospital. We have really also seen a shorter duration of stay compared to other waves. So I think just to summarize, we are seeing an increasing number of new cases each day. The percent positivity and testing rate as well is increasing in all provinces. This was initially in the younger age groups, but we are seeing some movement into the older age groups, starting to see some increases in hospitalizations in the majority of provinces, most notably Gauteng, because they had seen the increases in cases first. This increased admissions in the younger age groups is still persisting, but that pattern is shifting towards lower proportions, and particularly in the under 5 years, where there was initially a lot of concern. Early severity data is really shown that there's no signals towards increased severity in adults. Severity among children is being monitored, but at this stage, anecdotally, most pediatricians are saying that the children are also being admitted. Many are incidental COVID positives, and that they also have a short duration being in hospital, just between 2 and 4 days. And we're noting that the majority of admissions are in unvaccinated individuals. So regardless of the variant, I think we really know which public health measures are working in terms of the vaccination, proper wearing of masks, social distancing, and limiting in particular large gatherings. Thanks, Foster.
Thanks very much, Dr. Michelle Groom from the NICD for that comprehensive report as far as the Omicron and fourth wave is concerned. Without wasting any time, I'm going to call upon Dr. Matabo Matebula from the Steve Biko Academic Hospital to share with us the clinical and some personal experience of dealing with this pandemic. Over to you, Doc.
Thank you very much again, Mr. Mohale, and good morning to Minister, Deputy Minister, and the panelists and the viewers. Indeed, I'm here to present the status as it was on the 2nd of December, which was week 48 at the Steve Biko Academic Hospital, Tshwane District Hospital Complex. Next slide. The next one, please. Yes, just to remove the questions of why the complex, it is because Steve Biko and Tshwane District are two facilities that are linked by corridors, and they are just a walking distance from each other. One being a central hospital, the other one being a district hospital. Now with the COVID-19, the Tshwane District Hospital is the one that is housing all the COVID-19 confirmed patients. And then we have Steve Biko still trying to render under the circumstances, the regular, highly specialized services. So once the patient is COVID-19 negative, then that patient get admitted into the Steve Biko Academic Hospital side. When the patient is positive, then the patient get admitted into Tshwane District Hospital side, which is 200 beds in total. And then the current status is that as a complex, we have got 75 patients, of which 5 are vaccinated. 2, the status is unverified, and then the rest are unvaccinated. Next slide. Thank you. That is just the bed capacity of the complex. Next slide, please. Okay, just to indicate, like Dr. Krom and the minister have indicated, currently is still early times. So whatever we have is not, may not be the true reflection of what is going to happen or what is actually happening. This is the status, like we have said, of the beginning of the surge of the 4th wave. Next slide, please. That is just to illustrate how quick the wave picked up, and from comparing with the previous waves, just suddenly the surge hit us on Omicron variant, of which we think is the dominant variant. We don't have each case's genealogy to say it is truly only Omicron that we have in our facilities. Next slide, please. Just this is an illustration of the Tshwane Health District, where the Biko Academic Hospital is located. And as we have been informed, in between week 43 and 48, at week 48, the sub-district where Steve Biko is, which is sub-district 3, was leading in number of active cases of COVID-19. Next slide, please. That is just the admission from the 14th of November to the end of November. You can see we had very few patients admitted in total in the complex. It's actually the complex, not the district. Next slide, please. And then things started changing, but this is now the illustration of the ages, like Dr. Krom was illustrating that those were the age groups. Those are the age groups that we have in numbers. In the beginning, that's what was happening. We're seeing lots of children coming in. And another disclaimer that one need to make is that majority of our patients were not being admitted. We'll see that in the next slide. Majority, 21%, yes, presented with COVID-related complications that warranted admission. But 79% were incidental findings because of the screening admission, where we test everybody that is coming before we admit. Then the patient will be presenting for a specific condition. Then upon checking whether the patient has got COVID-19 or not, then they'll have COVID-19, and then ended up being admitted in the COVID-19 wards, not for COVID, but because they need admission for their presenting condition that warranted them to be admitted. The ages, as we can see, the highest ages that were admitted were between the age of 30 to 39 years old of age. The next slide, please. That is just the illustration of the proportion. We can see there that 0 to 49 we're taking the bigger chunk of our patients that were admitted. The next slide, please. Just This one is the 2 weeks that we are presenting, that we had the death rate that is illustrated there is not for COVID-19, is a combined number of patients that we had lost. It's just to show the proportion of the live discharges versus the ones that demised in total of patients that were admitted during the period of all these waves. The next slide, please. This is now the same, just to illustrate during the past waves, past three waves and the current wave, the proportion. Next slide. The acuity of the patients that we have currently, we can see that there's very few of them. Actually, as we speak now, we have got only 2 patients in intensive care, or 3, 2 adults and one pediatric patient. And those are the only patients that are in ICU. And then that is the proportion of the high care. The high care ones also, like the ICU, they are also admitted not because of COVID-19, but because of their other underlying conditions. Those are the ones in general wards. So majority of our patients are on room A, and then very few are on oxygen, and then they may be on oxygen for their underlying condition that they presented with, or they are on oxygen because of COVID-19, of which there were 9 that were on oxygen because of COVID-19. Next slide, please. That is the how it behaved with now all waves combined. We can see that we had a proportion of ICU patients and then high care patients. This is now patients that had COVID-19 and had to be in ICU and high care, and also in the general wards. But almost all were on oxygen. They were hungry for oxygen, which is not the case this time. And then up to this far, majority don't need any oxygenation. Next slide, please. This is what Dr. Groom referred to, the length of stay. They don't even stay longer because of the obvious reasons. They are just here to be stabilized. Majority, especially those that are in the general wards, are coming because their comorbidities are poorly controlled. There is still in the community, we are noticing that the compliance with chronic conditions seems to be falling behind, mainly maybe because of the community being reluctant to present in health facilities because they are scared to contract the virus. And then by the time they present, then they are, especially in the non-communicable diseases like the high blood pressures and the diabetes mellitus are not in control. Then such patients will need a day or 2 in hospital admission and then to be stabilized, and then they get discharged. The next slide, please. Thank you. This is just an illustration of the 42 patients that were there as of the 2nd of December. That is an indication of, like I've said earlier on, 14 of them were on oxygen, and then 9 of them were on oxygen because of COVID-19. And incidentally, those that were admitted in the COVID ward, not because of their COVID illness, were 33 patients. And then 66% were on room A, which is still the setting even as we speak. Next one, please. That was just to illustrate the vaccination status. Clearly, majority of those that were admitted had COVID, had not received their vaccination. Whether it is partial vaccination or fully vaccination, they were not vaccinated at all. And then there were those that we couldn't really verify whether they are vaccinated or not, 8 of them, that we are still trying to establish that. Next slide, please. Yeah, just to acknowledge the compiler of this data is Dr. Farid Abdullah, who is one of the doctors in internal medicine, infectious diseases. Thank you very much, Minister. Thank you. Thanks, Mr. Mohale. That's the end. The experience, Mr. Mohale, yeah, it's just to say you still do get, after your 2 vaccinations, even if you had some of us had a J&J and also the J&J booster, but you still can contract COVID-19. But like it has been said several times, vaccination does make the symptoms almost non-existing. And also the observation is that you really are unlikely to need admission because of COVID-19, and it's just patients that are admitted, that are vaccinated fully, just need, or we may not even call them patients, people that have got COVID-19 having been vaccinated really need to be taken care of by healthcare professionals. In the main, you can do your own self-care, meaning that the prevention, non-pharmaceutical, are crucial, because even if you're vaccinated, you can still contract COVID-19. Thank you very much.
Thanks very much. Okay, thanks very much, Dr. Matebula, for sharing with us both the report as far as the Steve Biko is concerned, and also your personal testimony of dealing with this pandemic. Indeed, we believe that this will assist and encourage other people who test positive to keep on complying with non-pharmaceutical interventions. Without wasting any time, I'm going to call upon Dr. Nicholas Crisp, who's going to share with us the implementation of what the surprise approved. Since a surprise approved the 2nd dose of Pfizer and 3rd dose of 2nd dose Pfizer for children and the 3rd dose booster dose for adults, we've been inundated with public and media queries. So I'm going to hand over to Dr. Crisp to clarify this issue. Over to you, Doc.
Morning, Foster. Thank you very much. Morning, Minister, Deputy Minister, DG, colleagues and the media. So I'll just give a brief overview of the numbers in a minute or two, and then I'll talk about where we are with the various boosters and things. So, and I'll specifically refer to the Pfizer second jab for adolescents, and then Pfizer boosters. What exactly did Cyprus say? And then I'll talk about Johnson & Johnson boosters. As the Minister indicated in his introductory comments, we expect to cross the 27 million mark this morning. We know that we have had a bit of a slow period, but it has picked up a little bit in the last week or two. The number of total individuals has also picked up. We have over 17 million people who've had at least 1 dose, either of Johnson & Johnson or of Pfizer vaccine. The graph on the right-hand side, this is the moving day, so it picks up and up every day until the week is finished. But you can see the vaccinations of individuals per week over the period, with a couple of dips that we know what happened. This was the period of violence in the country. This is when we started to run out of vaccine, and then we lost momentum, picked it up again, and now it's on a down again. I think as people are getting a little bit tired of COVID, but hopefully we'll pick that up. Just in terms of the total number of individuals vaccinated in the last 24 hours and what's going on, and who are these? This is now the children and or adolescents under the age of 18. It's picked up quite quickly, and I think that probably the change of the trajectory of this graph on the right-hand side was towards the end of exams, when adolescents were able to move around more and go for their vaccinations. And we've seen a very steep uptake in vaccination, in first vaccinations of children or adolescents in this age group, and we've crossed over 700,000 as of yesterday. Healthcare workers, as everyone knows, have been busy with Johnson & Johnson Sisonke 2. It's been a bit of a slow uptake. Healthcare workers have been getting sick in this last time, as we heard from Dr. Matabula, mostly mild, but nonetheless contracting COVID. Hopefully their condition repairs quickly and they get back to work. But we have had 208,000, so that's almost half of those who had the initial Johnson & Johnson vaccine have already been vaccinated with their booster doses by yesterday. So I'll concentrate just on this slide. This is my last slide, and just give a little bit of an update of what is happening with each of the vaccines. So I think everybody knows there was quite a lot of buzz yesterday when we opened the vaccination for adolescents, children under the age of 18 or between the age of 12 and 18, for second doses of Pfizer. Now, this was approved by SAHPRA at least 6 weeks ago, but the Ministerial Advisory Committee felt that we had time to be a bit cautious about the way we implemented it, because at that stage, 2 months ago, we were seeing reports in the international space of myocarditis or inflammation of the heart in mostly boys who were getting their second doses. So what has happened since then is that there's been a large amount of data gathered, a lot of reports looked at by the specialists in the committee, and they have established that the myocarditis rate after vaccination is pretty much the same as myocarditis rate in the general population. So there's no increase. However, what they did show us is that there's a massive increase in myocarditis, heart inflammation, in young adolescents who get COVID infection. So vaccinating and protecting adolescents against myocarditis is done by vaccinating them. So we have now determined that and got the advisory from the Ministerial Advisory Committee that we could proceed with the vaccination of the second dose for the adolescents. And this has solved a lot of problem for those who were 17 when they started, and now they're 18 and they wanted to get a second dose of vaccination. Some of them are traveling abroad for studies and so forth. And it all went pretty smoothly yesterday. I don't have the actual figure for boosters for yesterday, but we had no specific reports of problems with that. So that program will now run, and the population, the whole population, not only adults, but from the age of 12 will now receive 2 doses of Pfizer vaccine, 42 days apart, and I'll now talk about the booster. So Pfizer boosters, maybe just to emphasize that boosters are different from additional doses. We've spoken before about additional doses, and the additional doses are given after 28 days or more to people who are immune compromised, specific conditions that are listed, and they're on the website of the department, where the clinician then refers those people to the vaccination program for a third primary dose. Now, this is different. This is where after a longer period of 6 months after the second primary dose, the population is losing some immunity, and there's some quite good evidence that we all do, our antibodies do wane after that period. We may still have cellular immunity, and you're going to hear a more detailed presentation about this later. But we on the SAHPRA, which is our regulator, has now said that they find that it is safe and it is appropriate to provide booster doses 6 months after the second primary dose. Now, for us, that means that the first qualifiers for booster doses in South Africa will be after the 28th of December, because that is 6 months from the time the first people got their second dose. That's a couple of days before New Year, so we do not envisage introducing a major new program on New Year's Day or thereabouts. So from January, Once the VMAC has aligned, that's the Vaccine Ministerial Advisory Committee, has aligned with this approval, we will get the recommendation and plan the appropriate rollout of boosters at that time. And obviously, because we worked on an age basis rollout of these doses initially, it will mean that boosters will start off with people over the age of 60, and as people 6 months rolls up, they will be eligible for this vaccination. Now, Johnson & Johnson boosters, I think everyone will recall, has been following up the rollout of our vaccination program. We had a problem in the beginning. We had the Sisonke program that had run for healthcare workers, and then there was a global shutdown of availability of Johnson & Johnson vaccine for some time. And then we got some short dose vaccines, and then subsequently now we have a full rollout of Johnson & Johnson vaccine. Unfortunately, have quite a lot stored. Up to now, we have only been giving booster doses to the healthcare workers through the Sisonke 2 trial. Those figures I showed a moment ago with the just over 200,000 uptake. And that program started on the 20th of October and runs to the 17th of December. So what we've been doing in the background is working with the company, working with the researchers who've been doing this trial and a number of other trials to look at exactly what these boosters do. And we have got information now that boosters for Johnson & Johnson will be available to other people soon, not just the healthcare workers. We have established that SAHPRA has received the data package relating to booster doses from Johnson & Johnson. It did come yesterday. All the full data is now available. SAHPRA is very familiar with this vaccine and very familiar with the data. And the people who work there have worked with this data, including the Sisonke and Ensemble studies. So we're anticipating that together with the WHO review data that is available, SAHPRA is expediting the review over the weekend so that recommendations can be finalized next week. And once we have that information, the VMAC is on standby to make recommendations, and we anticipate that we'll be ready for vaccination of boosters for Johnson & Johnson, if not next week, then probably the week after, depending on the timing of the various outcomes of these committees' approvals. So that's all good news all around. By the time we all break for the Christmas period, it looks like we will be able to get all our vaccines rolling out. Thank you very much.
Thanks, Dr. Chris, for clarifying this question that has been haunting us since yesterday. I believe people have now understood. Without wasting any time, we always get confronted by the question on the effectiveness of this the current vaccine that we're using in the country against this Omicron variant. So I'm going to call upon Professor Glenna Gray, the president of MRC, who's going to be joined by Professor Alex Segal to clarify this issue of effectiveness of this vaccine, of the vaccine that we're currently using in the country. Over to you, Prof. Gray and Prof. Segal.
Thank you, Foster. Minister of Health, Deputy Minister of Health, DG, DDG, all protocol observed. So Dr. Alex Segal will be showing us some in vitro or laboratory work done in a test tube to look at whether whether there's any reduction in neutralization or viral escape, and he will show some data on that. While we look at vaccine protection, as Dr. Crisp already mentioned, is that the vaccine protection works in various ways, in multiple ways. There is a humoral response, which Dr. Segal will talk about, where we look at neutralizing antibodies and binding antibodies, and they're very important for protection. And then there's also the cellular immune response, which is guided by CD4 and CD8 T cell responses, which is very important for protection against death and hospitalization and severe disease. And so we have to remember that there are two arms of the immune system. So looking at the effectiveness, we have preliminary data, and I think both the minister and the CEO of the Steve Biko have shown us, as well as Dr. Groom, that in hospital admissions, there are far more unvaccinated than vaccinated people in our hospitals. So that's the first way to measure vaccine effectiveness is to look at the amount of people who are in hospital and monitor the breakthrough infections. And what we can see from the breakthrough infections, the majority of these are mild. And even with Sasonki, we've been monitoring the breakthrough infections in our healthcare workers, and most of them are mild, and very few have gone into hospital. And of those that have gone into hospital, the hospital stay has been around 2.4 days. So also, again, confirming the experience of what we're seeing in the hospital setting. We also will be able next week to evaluate the effectiveness of the Sasonki program, both with the people that have got the 200 or so that have got the double dose or the homologous boost of the J&J, and the ones and our healthcare workers who only took the single one, and we'll be able to evaluate the vaccine effectiveness in our using a test negative evaluation. But just preliminary work that we've been doing with various other people, we also have been evaluating the Pfizer vaccine effectiveness, and can also reconfirm what the minister said, is that we are seeing that this vaccine is maintaining effectiveness. It may be slightly reduced, but we are seeing effectiveness being maintained for hospital admissions. And so that's very encouraging and reaffirms that these vaccines work against severe and critical disease. But I'm going to ask Dr. Siegel to show the data. I think we have to again applaud our scientists. I think he's the first person in the world to have grown the virus and be able to evaluate the impact of this virus, of the Omicron virus on neutralization and viral escape. So again, congratulations for growing the virus in record speed and showing us the data that we critically need to help inform our future policy. Alex, over to you.
Thank you, Professor Gray, and good morning, Minister and Deputy Minister and colleagues. Yes, we were the first to grow it. I won't show you the technical data. The virus was successfully grown by a researcher in my laboratory, Sandile Tlere, and he's also has done a lot of the key neutralization experiments. I won't be showing you the technical data. I'll just get to the point, and you can ask me kind of as we go along what maybe some of our evidence is. Okay, so this is the key result that Sandile got over the last few days, and that's available on medRxiv. Basically, here we tested the protection, again, antibody protection, that's conferred by Pfizer BNT vaccination 2 doses, where we're taking these the actual blood sampling close to the time of peak antibody production, between 10 days and about a month post second dose. And I have to say, I mean, there's definitely an effect, but when I saw these results, and because of other technical information that I'm not presenting here, but that we got, such as the fact that this virus is using the same receptor as the other variants and the ancestral virus. So it hasn't, while it's changed a lot on its genome, it has not essentially changed how it behaves. This, to me, was actually better than I expected. And the reason is there is the neutralization, the ability of the vaccine to be able to elicit antibodies that can shut down the virus, neutralize it, is definitely diminished with Omicron compared to the sequence that the vaccine was designed to. However, this effect is incomplete. And what we see, especially in this group that was previously infected and then vaccinated, that while there is a strong effect, strong decrease of the ability of the vaccine to elicit neutralization of Omicron, it doesn't go down to levels that we'd expect to be non-effective. So certainly, how well the vaccine works for preventing infection would depend on how much antibody you have. So it's not, we didn't see a qualitative difference with this variant. We saw a quantitative difference. It's less sensitive for sure. You're gonna get less protection from infection for sure, but you may maintain sufficient antibody levels depending on how much antibody you have, and that depends, when you were vaccinated and whether you're previously infected. We did some estimates on this, especially with the severe disease, you have to take a little bit with a grain of salt, because severe disease is difficult to estimate, but we thought we'd try. And I'll just kind of look here at the left side of the table. This is probably going to change a few percentage points here or there, but not perhaps essentially. And again, the estimates for severe disease are much less concrete than the estimates, for example, for protection from infection. So protection from infection goes down a lot. So it's something like by 3/4 around there. Protection from severe disease, at least as we estimated, it does go down, but you still, according to these levels and extrapolating to severe disease, you have protection of around 70% with this vaccine. Now, I just want to mention another result that came after hours from Pfizer BNT, and what they found that after 2 doses of the Pfizer vaccine, the effect was that they saw was, again, a strong decrease in the ability of the vaccine to be able to neutralize, or the vaccine elicited antibodies to be able to neutralize Omicron compared to the virus that the vaccine was designed against. But they also saw this effect where if you get boosted, you have very little decrease, only about 3-fold. Now, I can't really judge these results with the boosting, because we don't yet have the samples ourselves, but it'll be very good if we or somebody else can confirm the results independently. Certainly, it's a heartening, unusual result. But the drop in neutralization after 2 doses is about what we see. So I will just conclude here that the results are certainly better than what I expected. There was extensive but incomplete escape of Omicron from Pfizer BNT 162b2, the Pfizer vaccine, elicited neutralization. Previous infection combined with vaccination gives good protection. So I think this is very positive. And certainly with so many people previously infected in South Africa, these people, if they haven't already done so, should be really encouraged to get vaccinated as well. And the last point is, yes, the protection from infection is going to go down from Omicron quite a bit, especially as there's waning of antibody immunity with time. So we know that, and the antibody immunity with Omicron is going to be less, and that affects the ability of vaccines to protect from, at least this vaccine, which we tested, to protect from breakthrough infection. However, we see no reason to conclude that vaccination will not protect with severe disease with Omicron. And the reason I say that is for 2 reasons. One is that we still see residual neutralization of Omicron. It's not a complete escape. So there'll be some antibody function there. And that may be enough to prevent most severe disease. The second reason is that the antibody immunity or humoral immunity is not the only arm of the immune system. And you also have T-cell immunity, as Professor Gray said before. And this arm of the immune system is going to be much less affected by all these mutations because T cells can recognize many more places on the virus than antibodies, just the way that it works. So I generally feel from these results that we've now put out that there's a lot of reason to be reassured that protection from severe disease is maintained.
Thank you, Alex.
Are we done, Prof. Glenn Gray and Alex?
Yes, thanks very much. I think it just reassures us that this data, what Alex showed in the lab, we're seeing in the clinic, increasing breakthrough infections, but protection against severe disease and death. And so he's confirming what we see in the field. So thanks, Alex.
Okay. On that note, I'm going to open the session for questions and answers. I'm going to take two rounds of questions. I'm going to take about 7-8 questions. Then we allow the panelists to respond, then take the last one. The first question is read as follows. It has been reported that nearly 20% of healthcare workers have been infected by this variant and are expected to isolate. This is a concern. Should 10 days isolation policy be changed? Second question, Pfizer claims that a booster dose on top of normal 2 doses will effectively neutralize the variant. What is your opinion on this assertion? Third question from Anthony Bloomberg, when does the government plan to administer approved booster shots now that they've been cleared by SAPRA? I believe this has been touched on by the presenters, but you can still elaborate on this one. The fourth question is, as festive season fast approaches and the president meets the NCCC with the rise in infections, when can we expect to learn whether or not the tighter restrictions will be imposed? Fifth question, why is vaccination of this cohort 12 to 17 not encouraged to take place at school as part of school health program? Sixth question, with early data showing that Omicron variant is more transmissible, will the government and health experts recommend changes to the current limitation of gathering? Question number 7, has public health officials and the department made any recommendations to NCCC with regards to Christmas-related gatherings? Question number 8, why did the department not initially allow the children aged between 12 and 17 to get 2 doses as done in many other countries, especially considering that we are encountering some problems calling citizens to come back for second dose and they're not coming in numbers? The last question of the first round, what are the plans regarding the booster shots to other public servants like educators who also receive J&J vaccine, who wish to receive the booster shot since they don't fall under the Sisonke program? I'm going to hand over to Minister and the members of the panel to respond to these questions before I take the second round of questions. Minister and members of the panel.
Thank you very much, Foster. I'll touch on some and then others, the team, both. I think there's a lot which will go to Dr. Crisp. Just in terms of the isolation, first one, whether the policy on isolation of 10 days because of the infection amongst healthcare workers, I must say that this is a matter which has been concerning us. We are sort of in a way comfortable now in a way that the numbers have not been rising as you know, steeply as we had feared in the beginning, but also that, as Dr. Matebula has indicated with her own example, that because majority of them are vaccinated, they isolate, of course, for 10 days, but you know, even if they have symptoms, they last very short period. So, but we can't really say that they should reduce the isolation period. We just have to find ways to manage the staff rotation, because otherwise there will be a risk, even because if you are infected, even if you don't have symptoms or mild symptoms, if you return to a work environment quickly, you will be a risk to the patients and also a risk to your colleagues. The second one, I'll ask Dr. Crisp, and the third one. On the fourth one, the festive season, let me just say that the NCCC will be meeting next week, sometime during the course of next week, either Tuesday or Wednesday, and we will make recommendations based on what we are reporting even today here. We will also depend also on recommendations from our ministerial advisory committee. So we're not in a position at this stage as to what kind of changes to level 1 or whether proposal to level 2 or what. We're not in a position to say so. We will be looking not only at the numbers, but also looking at the impact on the health facilities and all those risks, and the economy and social activities in society. So all those matters will be considered. We'll also get input from the Ministerial Advisory Committee on social behavior. So all those will make input. Number 5, I think that also on 12 to 18 years at schools, Dr. Crisp will take that. And then number 6, variant to motor with government and health expert recommend changes. I think it's the same as number 4. Those the changes which might be recommended will still be finalized over the weekend in preparation for the meetings, the meeting of Coronavirus Council and Cabinet in the coming week. Number 7, any recommendation Christmas related, I think is the same actually. We will make those recommendations. We'll finalize as we get the input from various committees, and looking also from our scientists here from NICD. We will then, by Monday, we'll finalize the recommendation. So at this stage, you are not in a position to can say what possible changes may be there. I think, Dr. Crisp, you can share with the other panel members, with the DG as well, maybe Deputy Minister who can come in, but these are all largely vaccination related questions. Can you take 2 and 3 and possibly 5, and then I think 8, it's also 12 to 8, I mean 12 to 17, why not started with 2 doses, plans, booster shots, I think you have mentioned some of this, but I think they just want more information. So if you can quickly run through all this vaccination. I know we are pressed for time, but we should give our audience and media all the attention. Please take over.
Yeah, Minister, thanks very much. Let me just respond to some as you requested and let the others catch up. Otherwise, it just becomes a monotonous voice. But maybe just to touch on when are we starting with the boosters? I did mention it, but I'll reiterate that. The recommendation is that booster doses will commence for Pfizer recipients 6 months after the second dose. So that's 6 months. The first person who got the Pfizer vaccine second dose will happen on the 28th of December. So we'll move a little bit after that to vaccinate people who've received Pfizer vaccines. There was a question about why did we not go to 2-dose for children from the start. So I'll take that one. There was quite a lot of debate about how seriously to take the story of the myocarditis. It had been raised right in the beginning, and there were several countries who chose not to implement a 2-dose Pfizer vaccine from the word go. We were not alone in that. So although the vaccine was authorized, there was a decision taken that we had at least 6 weeks between the 2 doses to use that opportunity to evaluate more data in the world space. And that's what was done. And as I indicated, we are now comfortable that there's no added risk, and there's no safety issue at all. And that's why the second dose of Pfizer vaccine for children between 12 18 has now started. I know it's been a big concern because we get a lot of messages around when will people, particularly those who are part of the public sector essential services rollout programs, when will they be qualifying for the Johnson & Johnson booster doses? And we recognize that that is an issue for people. What we did say right from the word go is that we will start by vaccinating healthcare workers for two reasons. One is they are the most at risk, and secondly, because they are the ones who got the vaccination first. So we needed to make sure that they had the time coming up. So I think we are now ready. We will be ready by some time during the course of next week for the decisions to be taken on exactly when and how we will make this booster doses available for those in the next rollout part of the program. Last question I will answer, Minister, is on why haven't we rolled out the 12 to 18s in the school program? A large part of that was because the schools were headed into exams, and it's very disruptive to start organizing vaccination programs during that period. And people are off studying and doing other things during that time. So it was decided, and I think we even announced at that time, we would take the time during the Christmas period to evaluate what is appropriate for opening vaccinations in the school health program in the new year. It's not as straightforward as it looks. It's a different set of vaccination organization that needs to be done. And we don't vaccinate all ages for other kinds of school vaccination programs. So it is a reorganization of that program that needs to be done together with the education department. We will get to that. Let me rather defer to others to answer some of the other questions because I know we're running out of time. Thanks.
Okay, I'm not sure. I think you probably have covered. There was a question as to why did we didn't initially actually start from the beginning to say the 12 to 17 must be 2 doses. I don't know if you've covered that, Dr. Crisp.
Yeah, Minister, I did. It was purely because of the myocarditis story. So we had reports of the myocarditis, and we were waiting for more evidence. That was the only reason we didn't go immediately to 2 doses.
Okay, I think for start, I think most of the questions were rather very related, either on restrictions, different angle of restrictions which I've dealt with. Again, just to say that there will be a review. The government is aware of a possibility that we might have to help the society in terms of reducing movement. The details will be decided in the coming week. And then I think Dr. Crisp has dealt with all those of vaccination. Can we take the last batch? Let's see whether there are no repetitions there, Foster. Let's proceed.
Yes, Minister, thanks, Minister and Dr. Crisp. I'm going to take the second, which is the last round. Yeah, you are right. Most of the questions, they are phrased differently, but they are looking for the same answer. So you'll bear with me if I repeat them. Yeah, the first question of the second batch reads as follows. Given the steep spike of infection and a lot of information on severity still filtering in, but so far not dire, what is the department recommending in terms of lockdown? So it's another question which has been partly answered. The second question, do we know what percentage of people in hospital who have COVID-19 have been admitted for other reasons? Is it not time for limitations on large gatherings to be imposed, even if lockdown level doesn't change? We'll go. Another question, given a high number of breakthrough infections, is there evidence to show whether unvaccinated people are more likely to spread this variant than vaccinated people? Can Minister also clarify if the NCCC discussions are still ongoing and have, or have they concluded? I think you have covered this one, that the NCCC will meet next week. But if you feel you want to still respond, you can do that, Minister. Another question, will the department update the definition of fully vaccinated to include the booster shots? Another question, many parents would like to have, would like an update on plans for vaccinating those who are 5 years and older. As we see in other countries, they begin to target this age group. The last 3 questions, in total, how many Omicron cases have been recorded nationally since the first detection? Can we confirm whether it's correct can you confirm whether is it correct that nearly 20% of healthcare workers are infected? And if so, what is the proportion? What proportion were vaccinated? Yeah, this is the last round of questions, Minister and members of the panel. Over to you, Minister and panelists.
Foster, I think you left. There's a last question which says Gauteng MSc said in a written question, South Africa is looking at using Paxlovid and Molnupiravir locally. I think these are antiviral treatments. I'm not sure if any of our practitioners could on the antiviral treatments. But let me just, in terms of question number 10, as you said, it's similar to the ones we have dealt with, the steep rise, lockdowns. I think that we have dealt with that the NCCC will meet in the coming week and decisions will be made in terms of how we respond based on recommendations, of course, from us also, as I've said, from the various committees which we consult with, ministerial advisory committees and various experts, including what we are discussing here. We'll summarize that into a recommendation to the NCCC. The question of do we know what percentage of people in hospital who have COVID have been admitted for other reasons? I wouldn't know. I would check with our NICD colleagues whether they might be able to deal with that. Just get ready. And then the question 12, limitation on gatherings. I think it's which I think is related also to all the others I've said about NCCC. The very high number of breakthrough infections is the evidence to show whether unvaccinated people are likely to spread. Unvaccinated people, Professor Gray maybe could comment whether unvaccinated people could be have a potential to exude more viral loads and so on. And then number 14, can the Minister clarify NCCC? I think we've dealt with that the discussions are happening in the coming week. 15, definition of fully vaccinated. Again, between Dr. Crisp and Professor Glenda Gray, what is fully vaccinated? I'm sure you could help us with that. Parents would like to uptake any plans. Okay, vaccination of under 5. Again, I would propose that Professor Gray and Dr. Crisp deal with that. And then how many Omicron cases recorded? I doubt if maybe NICD could. I don't think we have the full number, as not all confirmed specimen as genome sequenced. 20% of healthcare workers infected currently. I don't know where that figure comes from. Between Dr. Crisp and DG, maybe if there's any information in this regard, one of you can help with that. And then the antivirals, I'll leave it to any of the panelists who might be familiar. I know Prof. Karim previously did speak about the new antivirals, which are also effective. I think from my side, really, again, just on the issues of restrictions, the answer is that we will be able to announce once we report to NCCC. That will be either Tuesday or Wednesday next week. The other members of the team, Michelle, maybe on the one of, I think it was saying number 11, percentage of people have been admitted. I think And also there was something else. I'm sure you picked up.
Yeah, no, that's fine.
Okay.
Thanks
Over
very
to
much,
you.
Minister. Yeah, so I think in terms of the hospitalizations, I think through the pandemic, it's been very difficult to be able to know or to determine which of the hospitalizations are truly due to COVID-19. And so what we have always been reporting is the number of COVID-19 positives. And so that I think will go forward. I think there's different permutations as people may come in for routine surgery. There may be exacerbations of underlying disease. So at this stage, we're not really able to get a good handle on that. I think the data from Steve Biko did indicate that there was a fairly large proportion, but we won't be reporting specifically on that. And just in terms of the national numbers of Omicron, once again, we're not sequencing all samples. There is slight delays in terms of sequencing, of getting samples to the lab and conducting the sequencing. So I think with time, we will have an indication of the proportion of the sequences, in November that are due to Omicron, and therefore can make some inferences about how many of those that we're seeing nationally, but we cannot give exact numbers. Thank you, Minister. Over.
Okay, can we get, as we want to conclude, Dr. Crisp and I don't know, anybody else who can help with, I'm sure you've identified together with Professor Glenda.
Thank you, Minister. I'll try and be quick, and then Glenda can add to that. So the fully vaccinated definition is a definition we use all over the world. So we don't change those definitions. We'll wait, and it's fully vaccinated primary. So we will report the booster separately, and we collect the data separately, as we have done now for the booster on the Sosonke program. The 5-year and older vaccination, we haven't received an application yet. We did get an indication there may be an application for that approval early in the new year, but we don't have any indication for that. So we can't vaccinate children under the age of 12 yet, purely because there's not a vaccine registered for that. And then the question of Paxlovid and Molnupiravir, we have had discussions with the companies involved, and we have been collecting data in the public sector on which hospitals think that they might be able to, might want to order these medications, so we get an idea of the volume. And that's an ongoing exercise we're busy with at the moment. Thank you. I'll hand over to Prof. Craig.
Sure. Just on the information about transmission of vaccinated versus unvaccinated. So I think based on the data that Dr. Siegel showed, that that it doesn't completely, so that the Omicron doesn't completely escape vaccine pressure, we can deduce that vaccinated people are less likely to transmit than unvaccinated. That data will evolve, but as we've seen from the information we're seeing in terms of breakthrough infections, vaccination is still having an impact, and the data will evolve further. But the fact that there is not complete viral escape means that vaccination does have an impact on limiting transmission.
Okay, anybody on the antiviral? There's a question about antivirals. I'm out of practice, so I wouldn't know some of this. Paxlovid, Glenda?
Prof. Siegel said he's going to answer that.
Okay, all right, I'm out of practice, so I wouldn't know this. Sigal, Alex?
Alex is going. I'll just quickly, I think, are you going to talk about antiviral?
Alex is back.
Okay, I mean, I can just say a few words about the antiviral pills by Merck and Pfizer. So I believe the Merck one is interfering with proofreading in viral replication. So it's going to introduce a lot of mutations. The Pfizer is a protease inhibitor. This is a very popular way to inhibit viruses, just like in HIV. And I would think that perhaps the way to use some of these antivirals would be perhaps in the hospital setting. If you're starting to get more severe disease, or in individuals that are more vulnerable, because it will, while it will definitely not prevent infection, it will reduce the amount of virus and therefore may prevent more severe disease.
Okay, thank you very much, Foster. Thank you, Alex. We really run out of time, and I think we should invite Dr. Dlomo now, Foster. I won't be coming back, just to say from my side, just to thank all the team members. But again, the message is clear. We don't need to wait for NCCC. Let's do what we know best to protect ourselves, our families, our communities, in terms of all the non-pharmaceutical intervention, especially avoiding getting into crowds in the festive season, and also in the parties as we close at our workplaces, farewell parties and so on. But also but mainly also just to say, vaccinate before the festive. Thank you. I'm sure we can. I know Deputy Minister is under pressure also to go and do other duties. Over to you, Dinang.
Okay, no, thank you very much, Minister, and thanks to all our support that has come in. I wanted just to start by saying, Minister, and to all of the colleagues here and the South Africans, whenever I get an opportunity to speak to teenagers, I always remind them that we must hold on to those teachings of your mom and your dad and grandparents, because those advices are likely to assist you to navigate through life. Now, again, in this platform, our minister has been very consistent to actually bring to us scientists, well-renowned scientists, to really advise us on this pandemic. Now, why do we continue having South Africans who are saying, I'm confused, I don't know what to do, what to say? Rather, let's hold on to these teachings because they are unlikely to really make us face catastrophe in this disaster. In all that has been said, our scientists are saying there is evidence that says with or without a new variant, we are still safe if we are vaccinated. We are thanking Dr. Matebula, who's showing us what is happening at Steve Biko, where she's saying a majority of South Africans, or maybe people who are admitted in that hospital and they are in a COVID wards, are unvaccinated. So we are really still pleading with South Africans. Hold on to these teachings that we find here. And thanks to Professor Glenda and Professor Signal that they are bringing something that is well-renowned, first of its kind, to really show the growth of a virus. And that Sandile Cele was also part of the team. Thank you very much, Minister, for always exposing us to these well-renowned scientists, because you on your own can go on to advise us, but you prefer to be supported by scientists in the world to advise us going forward. I would really urge all South Africans to really rely on these advices. Let's vaccinate, because yes, we may still get COVID, but it will not complicate if we are vaccinated. Thank you very much, Minister, and thanks to the team and to Foster and to our South African viewers.
Thanks very much, DM. We understand that you are pressed for time. You are en route
over to you, Foster.
Yes, thanks, DM. We understand the pressure that you are en route to the University of Limpopo to preside over the graduation of medical interns. Without wasting any time, I'm going to thank the Honorable Minister, Dr. Joe Patla, Deputy Minister, Dr. Sumseni Dlomo, all our scientists, colleagues for being present, the media, for always being with us throughout this journey. Without wasting any time, I'm going to declare this media briefing agenda, but we want to assure members of the media that we'll always be there to take the interviews, respond to the queries whenever they have. Over to you. Thank you.